Hi, everyone, and welcome to the Becker's Clinical Leadership in Pharmacy Virtual Forum. I'm Mackenzie Bean, Managing Editor with Becker's Hospital Review, and I'll be your moderator for today's Fireside Chat with Dr. Heitham Hassoun, Vice President and Medical Director for International Services at Cedars-Sinai Medical Center. Welcome, Heitham, and thank you so much for joining us today.
Thank you. It's a pleasure to be here. What an honor. I look forward to chatting with you.
Me too. I know we have a great discussion lined up to talk about global healthcare in the post-pandemic era, along with some key opportunities for health systems. But before we dive in, do you mind telling us a little bit more about yourself and your role at Cedars-Sinai?
Yeah, sure. It's a little bit wacky. I'm a vascular surgeon. When I tell my friends and colleagues, like, what the heck, you should be in the OR saving legs and lives, and I still practice. But oddly, I started sort of as an academic surgeon at Johns Hopkins, really focused on science, my lab, and taking care of patients. But, we were at that time, at the forefront of developing sort of global collaborations. And I just became intrigued and got involved. And over the past 10, 15 years, really my career, as they often do, and I tell the younger folks that are coming in, sometimes you don't know, there are doors that open and you take them. And really, it's been my passion. Part of it is I grew up as an American expat overseas. My father moved to Saudi Arabia to work for the national oil company there, Saudi Aramco. And I always been sort of global minded and intrigued by different cultures and working in different cultures. And that really helped me personally adapt to this environment. I think, I left Hopkins 2 years ago, or a little over 2 years ago, to come to Cedars-Sinai as a career development to lead our development of our international programming. We might get into a little bit more of, what does it mean for a major U.S. academic medical center to do that. But we're really excited. We're growing and developing our strategy and our operations. And so, I love it. LA, what an amazing, beautiful city, global city. Of course, the pandemic has made us all go through some difficult times, but I think it's all part of our human journey. And so we keep looking ahead and looking forward.
Absolutely. I think the pandemic also has, really brought that collaboration to the forefront across the whole world in healthcare and in other ways. So I'm excited to talk more about this today. I know you and colleagues recently penned an article in which you say, the pandemic has come at a time of unprecedented global connectivity, technology, and wealth. So it seems like the capabilities are really in place for global health collaboration. Why isn't more of it occurring?
Well, that's a great question. I think, on the one hand, when I think of global collaborations, you got to take a step back and think of it as what are we talking about? Has it been occurring? And should more of it occur? I think certainly, like you sort of allude to, there should be more. Global healthcare, global collaborative healthcare are kind of components of the global health enterprise, if you will. The difference is that global health, which come out of schools of public health, schools of medicine, universities, what have you, really tend to focus from a business culture perspective in low middle income countries. And I think global healthcare to me is really more about how do you provide access to cutting edge, high tech, high touch care, the best the world has to offer to everyone, no matter where you are, rich country, poor country, in between. And how do we, and so in that context, I do think that in today's world where we are so connected, there should be more collaborations around healthcare. Why is it not as much as we might like? Well, I think there's a lot of elements to that. Number one is cultural, not culture in your ethnicity, but in the culture of healthcare. It's long mostly been perceived as a local right or a local entity. So when people develop hospitals, health systems, wellness, enterprise, whatever it is, it's thinking about your immediate local community. And that is natural. You should. But at the same time, we need to extend that into regional and global context because people are on the move. education is accessible to everyone. So I think it's very important, really, as we begin to shift the culture of how we think about delivering healthcare. I think some of it's regulatory. So, what role is the government doing, our government, any government, in facilitating, international exchange, whether it's for the actual delivery of care, we call it international patient services, or medical travel in the industry, or whether it's about joint research, collaborations, sharing of information, establishing international guidelines, all these types of things. I don't know. I was in Turkey not long ago, and what a fascinating place in the context of medical travel and what the government has done. And I'm not singling out Turkey, that there's other countries. I can list another, at least handful off the top of my head, that do an amazing job. But I happened to, was there not too long ago, and sort of collaborating with sort of the institutions, if you will, that facilitate business for patients to come to Turkey and receive top-notch care. And I think the things that the government do, whether it's incentives, logistics, and travel and visas and what have you, is tremendous. And sure, they want to bring business and they see that as important. But I think that the governments need to play a larger role, including our own in the United States. And when I tell some of my colleagues, they say, well, it's so big and complex. Sure, but whether it's local or regional or national, we need a voice, we need advocates, we need to get more support from regulatory bodies. I think it's part economics. Again, I think there is the unit of the price, if you will, or cost of a unit of care is so different. It's just so different from country to country, environment to environment. Sure, we are the most expensive place. So, if how do we create sort of standards around pricing models? And that sort of thing creates a lot of challenges. And so I think the pure economics of it creates some barriers. I think the lack of private sector development, and I think that's where the big opportunities, obviously, if we look at it from a positive perspective. I think investors around the world in so-called emerging economies are investing in healthcare. They see that they can get a return on investment. And, it's not just a business. Even if you believe access to healthcare is your right, fine. But at the end of the day, it doesn't mean that you can't provide the best level of care and get a return on the investment to those who are delivering or creating those assets. And it's very complex. I think here in the U.S., we're a bit more focused today on value, because we've shown that we can do private healthcare delivery and provide the best that modern medicine can offer, but sometimes we leave people behind, and sometimes the cost of that is too high, and sometimes we do things that don't provide value. And so we are learning and developing, but different parts of the world have different stages of where they're at. Finally, I would just say, again, getting to the issue of why isn't more of it, some of it's transparency. So, I think if there was better transparency, which kind of leans into like international standards of care, it might be easier for, health systems or governments to collaborate.
And just to clarify, transparency into health costs, processes, what are we looking at there?
Yeah, I think all of that. I think you need to, when I think of transparency, it leans a little bit into creating processes and standards. So I think the other side of transparency gets really almost personal. Like, something that intrigues me is, how does someone decide who they trust to their lives to? And it's scary, it's scary if you, and let's say you have all the resources available to you. It doesn't mean that you necessarily get access to the best care, because how do you know? Hospitals are not transparent necessarily with their, contracted rates, right? That's a big hot topic. It's not my area, so I don't get into what's right and what's wrong, but I do think that the consumer needs to know about your outcomes. They need to know about your, the costs, if you're an insurance company, about your payer contracts, And, there aren't clear standards. And so they're left there to kind of navigate a space where there's information that you're just getting, that some of it's going to be, valid, some of it's not valid. And I think if we promote more transparency in our outcomes, our pricing models, and the value you get in the care, then the consumers can then make an educated decision.
Absolutely. And I think you have given us a really nice broad overview of some of those key challenges and obstacles to achieving that global healthcare, as you're defining it as making sure that highest level of care is available to any country, regardless of income status, et cetera. And let's zero in now on healthcare organizations' role in all of this specifically. What would you say are 2 to 3 of the biggest opportunities for health systems to help fuel more international cooperation on global health?
Well, I think the opportunities are boundless, really. If we take it from a simplistic perspective, again, I'm wearing my hat as an academic sort of physician. We gravitate very simply to creating relationships, and I think I put that under the bucket of training and education. So there's no doubt that we stand amongst the best that medical education, nursing, what have you, has to offer in terms of training and developing. And I think people want to come to our and learn from us. But I think at the same token, we need to think globally and build relationships where we can go and educate and train, whether it's on a short or long-term basis. I think the development of like medical schools overseas have been moderately successful. If you think of places like Cornell in Qatar, Duke in Singapore, and at Johns Hopkins, we had for a period of time this kind of effort. As well in Malaysia overseas, and it hasn't really continued. I think part of that is trying to figure out the business model around that. But if you scale it down to just short-term engagements, I think that's a good place to start. I think workforce development, in this pandemic and post-pandemic era, is going to just explode. Literally, our brains might explode trying to figure out how the opportunities are in terms of accepting the remoteness of it, that we can connect as people in real time and have impact, whether you're like us right now interacting didactically or in a conversation, whether you're in the OR and using technology, which is amazing today, to literally be in the operating room and helping a colleague get through a case and getting the best outcome. I think we have so many opportunities in that regards. I think if you think of it from a business perspective, I alluded to the private sector development is just driving opportunities. And I think again, from a U.S. hospital perspective, we just need to get engaged. And, the challenges there are that gets back to the economics of it. When we have, the salaries, the cost of living in Southern California, if I were to give those numbers to some colleagues in different parts of the world, they literally will have a stroke, trying to figure out how do you even, so that does create challenges. But if you have the courage to find value in things beyond direct revenue, if you have a long-term perspective, then you will find that engaging in private hospital development, sort of projects is very rewarding for the bottom line and for the impact. I think, the big thing, a couple other things, another simple thing is accreditation. So, I'm proud that Joint Commission International, Global Healthcare Accreditation, these are, the JCI is more of like the Joint Commission Accreditation for Hospitals, have been hugely successful. I think that Global Healthcare Accreditation is a newer entity that's focused around medical travel and the whole paradigm of travel and the things that go into it for hospitals. But I think if that's your comfort zone, getting and helping other entities achieve accreditation or helping to develop better models for accreditation is a way to get global. And finally, it's all about technology, right? So telehealth is completely it's here, and there's so many dimensions to that broad term. but I alluded to it. But I think really that's what's going to carry the day going forward is acceptance. We are well behind on sort of the regulatory aspects of that, and we can maybe get into that a little more. But I think that that's going to stimulate a lot of these opportunities to become more global and to expand your reach beyond just your zip code or your immediate catchment area, so-called catchment area.
Yeah, it really seems like there are boundless opportunities, and I like what you said about finding the courage to sort of chase value beyond immediate revenue or thinking more long term. One thing I want to make sure we touch on today too is the global medical supply chain. I mean, as we all know, the pandemic has really revealed a lot of cracks in the system, sort of its inefficiencies and fragility. How can the US work with China, which, as we know, is a dominant player in the PPE market, to improve the global supply chain and prevent PPE shortages from occurring whenever the next health crisis hits? How can we be more proactive about that?
Oof, that's a big one.
$1 million question.
Well, I think let's break it down a little bit, so when February 2020, we were I had a good sense, not just me, but many who are engaged in collaborations in China had a good sense of what was happening and the impact it might have to us. Actually, I take it back, really around New Year's of 2020. Because we have a consultant who's based in Shanghai, we have a collaboration in Shenzhen, and we were active there, and had an eye on the fact that there's a problem happening. And then by the time February came around, they were asking us, please, can you round up masks and supplies, right? And so, I actually pushed our COO. I'm like, what do you mean? We got to send them something, let's package it up and send it. And, okay, we ended up getting a little bit of materials, and many of the US hospitals were doing that. And the response to me was, hey, that's great, but this thing may be coming down the road. And then in my ignorance, that turned out to be a very valid point, because come March, or April, we were getting flooded, not just us, many of the US hospitals with, the supplies. But the fact is, they weren't getting to us. So the first difficult thing is not so much having the goods, it's how do you actually transport it. And you get into a whole discussion about the logistics of supply chain. And as it unfolds, anyone can see that all the different startups and people trying to turn these PPE conversation or business. I'd like to, I think we have a lot of work to do on that. I don't think we're going to live in a pandemic. We have pandemics that happen, and certainly I would say it's fair to say globally, as we might have been prepared, but maybe never really had done the rehearsal, if you will. So many elements of this have been not up to standards of modern times, I believe. But having said that, I think of supply chain more broadly. So when you get into this concept, it gets into what are you supplying? What about knowledge? Supplying knowledge, supplying services. So it gets back to that issue of collaboration and creating standards for this. I think in that context, I would say China is doing better. I mean, they certainly are having more of an impact in terms of investing money in research and developing. But you're talking about the two biggest economies in the world, US and China. US funds half of the world's research in biomedical research and development. And so, that's not really tenable. It's not sustainable. I mean, certainly Western Europe, you basically take US, Western Europe, and then Japan has, and then that's it. You're talking about, you get to well over 90% of the funding for research. So certainly China has picked up in recent times, and I think they'll become a dominant force. If you focus on healthcare, China, if you focus outside of healthcare, if you take the world's top 11 tech companies, 9 of them are from China and 2 are from the US. And if you look in healthcare and you take the top tech companies, none of them are from China. And you basically go to US, a couple of, other sort of Western European and Japan, and I might have missed one in sort of the so-called OECD countries, but it's reversed. So I think that from a healthcare perspective, we do need China, we do need India, we do need other countries, that are that are major sort of economic countries to come up with innovation. And to me, that's part of the supply chain. It's not just the production of masks and things you wear. It's all that goes into it. It's the research, the development, the life cycle of bringing to bear pharmaceuticals, devices, processes, things that improve human life. And there is a business from that. And then there's also, the other aspect of it, which is being having an impact and leading the world. And so I think I will close it out by saying that, of course, it goes way beyond healthcare, and how U.S. and China will work together and how it's regulated is obviously way above my pay grade. But I hope for a better future because I think that the world would benefit.
Absolutely. And I know we're quickly running out of our time today. I wish we had 40 more minutes to chat, but I want to make sure we spend some time talking about some of the specific work that you are doing and your team is doing at Cedars-Sinai. Specifically, I know the Medical Center has launched a pretty unique collaboration with South Korea on medical device research and development. Are you able to share a little bit more about this effort?
Yeah, I mean, I'm happy to sort of, so I think we have, I consider that with academic collaboration. Mm-hmm. So, in our development, if you look at it, we have consulting work, we have affiliations with hospitals. I think in the context can go all the way up to management joint ventures. But then there's this thing called academic collaborations where, I think we want to partner with like-minded, equally successful or equally experienced, or whatever word you want to put in there, partners. And I think we have found one here. And then you say, okay, well, how can we make, an impact? And it's not about direct revenue, it's about impact. So in this case, the medical tech, there's a medical device company in the middle, if you will, that has a relationship with Seoul National University, and and our own experts. So this is in the realm of sort of GI oncology or GI surgery, and together they're working as colleagues and finding better ways to do a surgery and using the device. So we said, okay, well, why don't we collaborate on this and create this kind of three-way collaboration, if you will, where we're going to develop the technology, we're going to test it and research it and improve it in both of our countries. And in the middle is we're going to have our faculty and trainees kind of share that, experience in both places and figure out how we can build off of it for the future. So I think this is a very good model, something that's not too complex for us to engage. And so I love the aspect of the medical tech. I know we don't have time. I'd love to go into the whole, I was sort of ranting about the research and development funding, but I think, you can even take it further about the medical device development and how, how much of that has been traditionally owned and developed by the United States, and how clearly that is changing, and how we need to be finding ways to collaborate to bring products or processes to the market and gain from that from a U.S. perspective in collaboration and partnering and that sort of thing.
Well, Heitham, it has truly been a pleasure to hear some of your perspectives on global health today. So I just want to thank you again so much for joining us and for your time. It's been a pleasure speaking with you.
Oh, always a pleasure, Mackenzie. I really enjoyed that. Thanks a lot for inviting me.
Of course. And I also just want to thank our attendees for taking some time out of your days to be part of the Becker's Clinical Leadership in Pharmacy Virtual Forum. Please be sure to check out our other great sessions during the forum and let us know if you have any questions, comments, or feedback. Otherwise, thanks again for joining us, and we look forward to seeing you at future Becker's events.